Welcome back, everybody. Medicare and Social Security expected to be major themes during tomorrow night's VP debate. Republican Vice Presidential nominee Paul Ryan, he made a name for himself on Capitol Hill with his budget plan, the so-called Path to Prosperity, which, among other things, would turn Medicare into a voucher system and make it easier to cut Social Security benefits. Well, joining us now to explain what Ryan's budget may mean for you at home, Robert Hiltonsmith. He's a policy analyst with Demos, where he focuses research on, among other things, retirement security. In fact, he recently authored a report called The Retirement Savings Drain. Robert, welcome to the show. Thank you.
Rich, thanks for having me.
Well, first of all, bumming me out here with this report here. You think 401ks and other, investment IRA opportunities are pretty much not only safe things, but you're not going to be losing a lot in fees. Going through your report over the lifetime here, you're talking potentially about 6 figures that are going out of your pocket. It seems for a lot of folks we're none the wiser.
Yeah, no, indeed. And I think that's because these really have been sold to us, these 401ks and IRAs, as safe products over the years. And and also these fees haven't been disclosed up until this point. They're in plan documents, but they haven't been shown to most consumers. So when they get these fee reports here in the next week or month or so, I think it's going to be quite the shock to a lot of people.
Well, tell people what's going to shock them. Obviously the number, but what are these fees going towards? Because, for the most part here, there's not a heck of a lot of management with somebody's 401k plan or the IRA. They basically invest, they sit back, and they wait until the golden years when they take it out. It seems that in the meantime, a lot is getting taken out, but for what?
Well, there's obviously a lot going on behind the scenes, but the truth is, you're absolutely right. There's not a lot going on, and we're being charged a lot by these financial firms to do not a lot in a lot of cases.
All right, let's pivot to tomorrow night at the VP debate, where we know, among other things, we're going to hear a lot from Paul Ryan, a self-professed fiscal wonk here, who's going to say his plan, the one largely adopted by the top of the ticket, he'll give the caveat that anybody 55 and over, don't worry, this won't apply to you. But for anyone 54 and under, talk about his vision for the future of Social Security and also Medicare.
Well, that caveat right there really should be indicative of what's in this plan, because if the plan were so good, wouldn't people 55 and older want it, right? But so basically what they're going to do with Medicare is turn it into a voucher program. They don't like to use those words, but that's exactly what it is. The government will give seniors a flat amount to go out there and buy private insurance on the private market. And there are various versions. The amount may change depending on your income level. You may get more, but in essence, it's a voucher, and it rises some each year with inflation, but by most estimates, including the CBOs, not enough to keep up with inflation. So what's likely going to happen is there's going to be a larger and larger gap between the amount of that voucher and the cost of that private insurance, and it's really going to have a big hit on seniors' pockets.
To somebody who in their 30s right now, who the last thing on their mind is worried about what happens when they retire and what they're going to have, right, whether it be their Social Security or what wherewithal they'll have to support themselves, their family in their later years. Can you give an idea, and even scare them a little bit, about the train wreck that could be coming down the pike right now, not just with the Ryan plan, but also just basic math, that it's not going to be the same as it was for their grandparents, let alone their parents?
Well, I think as a caveat, I think that the train wreck has been a little bit oversold to us, that I think especially on the Social Security front, it's not as much of a train wreck as the people who don't like the program or would like to cut Social Security would have us to believe, right? We know that society's getting older, but this kind of, the shape of the population, a lot of people kind of call it the ratio of retirees to workers, is going to level off in about 10, 15 years once the baby boomers retire. So Social Security isn't in really as bad shape as it's been made to believe. And, I think as young people, as a young person myself, we should be able to expect what we've been promised in Social Security coming down the pipe. Now, Medicare and medical costs are another thing altogether. With healthcare inflation rising as fast as it is, Medicare really is unsustainable unless we do something to get healthcare costs under control. And that's exactly what we need to do. Medicare in and of itself is an unsustainable program. It's because healthcare costs are rising as fast as we do. And if we can get those under control, and we know there are lots of ways to do that, then we should be able to see the similar or even the same kind of Medicare that our parents and our grandparents enjoyed.
Well, you'll see right there on your screen, everyone, we've put up the web address where you can check out Robert's latest report here. And for anybody who's got a 401k or an IRA, I strongly suggest you go through it. Robert, I appreciate a few minutes. Thank you so much.
Thanks very much for having me on, Rich.
All right, everybody, stay with us. RF will be back right after this.